I always thought it was a possibility because I knew that I had a significant smoking history. I was hoping that the fact that I had quit smoking at that time, it was like 14 years prior, I was hoping that that had mitigated my risk, right?
Just a big slap in the face or irony of it all that I was so anti-smoking, so about, trying to prevent lung cancer, and then I got diagnosed with it anyway.
I've never had this major surgery. I've never only lived with one lung. I don't know what the reality of that is. I can hear words, but that doesn't matter.
My name is Donnita. I was diagnosed with lung cancer at the age of 68. I was diagnosed at stage 1A2, non-small cell lung cancer, adenocarcinoma.
My name is Sydney Barnett. I am a physician and patient living with stage 4 lung cancer from 2017. I was diagnosed at the age of 33 when I was going through my medical internship for residency.
Hi, my name is Calvin, and I was diagnosed with stage 1 lung cancer at the age of 33 in 2000.
I had no symptoms prior to my lung cancer diagnosis. I had read in my benefits brochure for Blue Cross Blue Shield back in 2018 that it was one of those WellCare checks and that I was eligible for it. That afternoon, they were like, you need to get to a pulmonologist immediately. It's urgent. So I did. And from the time I had my screening till the time I was on the table for surgery was 6 weeks. It happened quick. My head was just spinning.
I am originally from Jamaica, and I was working in the Jamaican medical system there. I recognized that something was kind of off when I was running. I just felt like I was kind of huffing and puffing like an old man, and for me that was unusual. One night I actually woke up just feeling like I was having difficulty breathing.
In 2000, my daughter is allergic to peanuts. And so we were at an allergist and asthma center, and we were getting her tested, and I asked her doctor, I said, hey, can I just get a meeting with you? Because I supposedly have had adult asthma for the last few years. It's not getting better. Came in, did the allergy test, some asthma tests, and she's like, you need to go get x-rays right now. So I went to the pulmonologist, did a bunch of tests, and she said, you have one of three things. She goes, either one, you have this fatal lung disease and you got maybe 6 to 12 months. 2, you have cauliflower lung, which is what a lot of people get from vaping or whatever. And I've never smoked tobacco, and so the third option, she goes, is you have lung cancer.
They said that a nodule had been found, a suspicious nodule had been found. And I mean, I didn't even hesitate to think that that's lung cancer. A suspicious nodule is lung cancer. I mean, it was an immediate thought in my mind. And I'll never forget how very calm I was. I didn't connect the dots with me at that point. I didn't realize that I had been a victim of the glamorization of the tobacco industry. I didn't connect that that's the way society was, and I was pulled into it. I didn't connect how addictive it was. I didn't connect the radon exposure. I didn't connect the asbestos exposure at that point. So that was all part of my growth, as my heart still breaks for those are diagnosed at a later stage, but I've managed to be able to get past my survivor guilt as I've started to realize that I was a victim and that I didn't deserve to get lung cancer.
I know, when I was diagnosed, my father was pretty upset because, we basically missed it in Jamaica. I kind of look at it a different way. I don't want to say everything happens for a reason, because what would the reason be for me to get lung cancer? But I think that being diagnosed when I was over here gave me access to all of the tests. It gave me access to learning about the fact that I had a biomarker. It gave me access to the fact that I didn't have to do surgery. I didn't have to do chemotherapy. I started straight away on the targeted therapy. Even though my diagnosis is stage 4, and that sounds so scary, I have been pretty functional, even with, my met to the brain. It's kind of like, yeah, things could have been found earlier, but I think that my quality of life probably wouldn't have been as good as it is now.
When we went in, our surgeon, he said, look, I think there's a small chance we can save half the lung. And he walked through the process and he said, look, I need you to give me permission that no matter what, I can do what I think is in the best judgment. We're like, yes, doc. Then the surgeon calls her shortly after and says, hey, it's worse than I thought. It's in another area, and I could try and save half the lung, but if I do, you'll probably be back here in 2 years to take it out. Not worth it. And I had to relearn how to walk, urinate, everything. Everything was just not working. And so having to relearn how to walk and all the other fun parts of it, but then not being able to see anyone else, particularly my daughter. And 4 years prior, when I first was getting sick, had they immediately diagnosed and figured it out, I don't know that I would have cared as much because I didn't have my daughter. It was all about I need to get back to as best as I can be because 1, I'm her dad. 2, I'm the one that she plays with. I need to be able to still do these things with my daughter.
I was an infant. I was about 11 months old. My mother took me to have a professional portrait taken of me. Mom had me all dressed up in a pretty pink dress. Back then, women always had their cigarettes in a cigarette case. She put the pack of cigarettes in my hand. There for eternity is my beautiful infant professional photo with me sitting there with a pack of cigarettes in my hand. But see, that just shows you how culturally the norm was that was acceptable to do that she thought nothing to put that pack of cigarettes in my hand for this professional photo.
Lung cancer is evolving, it is changing, and we need to get rid of this stigma. I've had, too many times to count when I tell someone of my diagnosis, the first question is, oh, did you smoke? The answer is always no, but should that matter? The thing is I find that there is a general lack of empathy for lung cancer patients, and that's what translates into the resources that lung cancer patients have, the facts that the research is underfunded, even though it is the #1 cancer killer of both men and women. I think that having younger and younger faces come up and show that anyone with lungs can get lung cancer, then that will help to kind of break this stigma down so that we can get, the awareness that we deserve.
None of us are standard anymore. Go do what you need to do to find out what is wrong. You don't need to be a smoker to have lung cancer. There's people still running triathlons that have lung cancer. Go and find that and go get tested if you think there's something wrong.
When I first found out I had lung cancer and I first found out others had lung cancer that didn't have a smoking history, I felt incredible shame. Please, nobody should feel shame because nobody deserves lung cancer. Smoking is a very addictive habit, and there are other risk factors. I had the risk factors of radon and I had the risk factors of asbestos too. Just because I had a smoking history, that does not mean that that's what caused my lung cancer.